Dr. Caffery here. Today I'm going to continue our discussion on hidden causes of fatigue. Hidden cause number 7, chronic infection. And when I say chronic infection, I'm not necessarily talking about an obvious infection. So if you have that, you know you have it, and that can make you feel run down and fatigued. But a number of individuals with chronic fatigue complaints actually have subclinical or low-grade infections. A lot of times they're dealing with a viral infection. So viruses have a tendency to stay dormant in your body, and then when your immune system gets depressed or suppressed, they can actually start to replicate or increase their load. The immune system will engage that virus and it causes an inflammatory response. That inflammatory response can give you symptoms of sickness behavior, fatigue, malaise, depression, brain fog, muscle aches, things like that. We discussed some of this in our previous video when we talked about inflammation. So this is something that will be picked up on a blood chemistry, something called a complete blood count with differential. So you have to look at certain immune markers there to see if the immune system is engaging or fighting an infection. So there's very broad reference ranges that you'll be compared to. These have to be looked at in a more sensitive light sometimes to be pick up these more subtle patterns. You look at the white blood cell count, a lot of times you'll see it less than 5, and you'll see the lymphocyte percentage a lot of times above 40. So if you see that, you have to consider that you might be dealing with a chronic viral infection, and then you might want to do subsequent investigations to try to localize what you might be dealing with and if it's active or not. I would say by far, one of the most common ones I see is a reactivated Epstein-Barr infection. So Epstein-Barr virus is what causes mono. A lot of people have Epstein-Barr in their system, and it can become reactivated and give you some of these fatigue-based patterns and complaints. So in summary, if you have chronic fatigue and it's unexplained, you might want to consider that a subclinical or a low-grade virus or infection is causing or contributing to your complaints. You want to work with a practitioner that can run some of these markers, complete blood count with the differential, look at some of these markers in a more subtle fashion to see if that's something that you are in fact dealing with, and then initiate the appropriate treatment strategies. I'm Dr. Caffery. Thank you for listening.